I'm going to show you how to get rid of hypoglycemia with just one tiny, simple change. Now, what is hypoglycemia? Well, technically, it's a blood sugar that's below 70 milligrams per deciliter. And it's actually rare to have blood sugar being low when you have hypoglycemic symptoms. The great majority of the time, you have all the symptoms, yet your blood sugars are normal. And when I talk about symptoms, I'm talking about shakiness, irritable, anxiety, hungry, sweating, headache, can't concentrate, blurry eyes. And so you hear this a lot where, oh, my blood sugars are crashing. I need to go eat something, right? But most of the time, if you were to check your blood sugars, it's just normal. So, what is going on? Well, I want to explain this by using earplugs. Okay, if I were to put these earplugs in my ears right now and you were to talk to me, I wouldn't be able to hear you. In fact, you would have to shout at me for me to hear you, to penetrate this resistance. So, with hypoglycemia, you have something going on. You have this resistance. It's called insulin resistance. Okay, now insulin is the hormone that helps to lower blood glucose. And just so you know, regarding blood sugars, your body has this superior, I don't know if it's like a law in the body or superior principle that no matter what, it's very, very, very important to keep your blood sugars normal. And it's even more important to keep the blood sugars higher than lower for survival. Your body will do all sorts of things to prevent this lowering of your blood sugar. Your brain needs glucose or certain parts of it. And without that glucose, you will not be able to survive. And so insulin is the main hormone that comes in there and lowers your blood glucose if it's too high after you eat. And insulin is triggered by two things. It's the carbohydrates that you eat and how refined they are or how much concentrated sugar. And also, it's the frequency of eating. So, if you eat a lot of meals, a lot of snacks, you're going to keep spiking insulin over and over and over. And the problem is that when you keep spiking insulin chronically over a period of time, you develop what's called insulin resistance. It doesn't lower the blood sugars as well as it should because you have these earplugs in here. So if I had these earplugs in there and you were talking to me, you would literally have to shout at me with high volume of communication to penetrate so I can hear just a little bit. Well, that's what happens with hypoglycemia. You have a situation where you may normally have normal blood sugar, but you have high insulin in the background to try to penetrate this resistance so you can at least get some control of that insulin to help lower the blood glucose. So the body keeps compensating over time to stabilize its blood sugars because if you eat a carb, the blood sugars go up, the insulin kicks in there and pushes it down. Well, we can't have low blood sugar, so the body will start to develop resistance against the thing that is pushing the glucose down. Now, what's abnormal about this whole thing is that our bodies were not designed to consume the amount of carbohydrates that we consume. So that's really the underlying root cause. And the glucose in the blood might be normal, but because insulin controls glucose absorption, you probably have very low amounts of glucose in the actual cell. In other words, glucose absorption in your cells is dependent on insulin. So the more insulin resistance you have, the less glucose you're going to have in the cell. And if you have low insulin in the cell, which I don't even know if they have a way to test that, but the point is you're going to have hypoglycemia symptoms with normal blood glucose, and in the background, high insulin. The medical term for this is called hyperinsulinemic. That means high insulin in the blood, hypoglycemia. Hypo meaning low, glycemia meaning sugar. It's probably one of the most common types of hypoglycemia, especially for kids and infants. Now, the worst thing you can do, okay, for hypoglycemia is to continue to have these small meals, okay, even small protein meals to try to fix it, or even worse, some sugar to raise your blood glucose higher. That's the worst thing you can do because that's going to trigger more insulin. It's going to make things worse and worse. You'll feel better temporarily, but it's going to be worse and worse over time. So it's a complete myth or even a lie that you should have small, frequent meals to prevent low blood sugar. And it's also a lie that these frequent small meals somehow stoke the metabolic fire or stimulate your metabolism. Absolutely not true. And it's also a myth that breakfast is the most important meal, even though I used to recommend it. I don't recommend it anymore because actually, when you eat, it stimulates more hunger about an hour and a half later. Why? Because of this whole insulin thing that's going on in the background. How do we fix this? You have a couple different types of fuel that you can run your body off of. The majority of the population is running their body off of glucose. And so when you're doing that, oh my gosh, you are dependent on trying to get glucose all the time because we don't store a lot of glucose. We only have a very small storage of glucose. It's called glycogen. It's in your muscle and your liver. And when that runs out, oh my gosh, we need quick energy, right? We need glucose. But what about fat? Why not just run your body on fat fuel? You have a lot more storage of fat than you do glucose. An average person who is not skinny has literally 100,000 calories of stored fat in their body. That's enough to last at least 3 months or longer. The world record of the person who fasted the longest was over a year without food, and they survived and they lost a lot of weight. The point is, you have almost an unlimited ability to run your body off fat fuel, and our bodies were designed to do that. And I'm now going to convince you that that is the best fuel to run your body off of. And when I say fat, I'm talking about fatty acids and ketones. Ketones are one of the byproducts out of fat. So you can run the body on a combination of fatty acids and ketones, but they both come from fat. What's really cool about running your body off of fat is it only takes a few days to switch over to this new fuel system that your body's going to be like, wow, this is a lot better than the glucose because my appetite went away and I feel so much better. Big thing that's so beneficial about ketones and fatty acids is that you don't need insulin as a hormone to be involved. So this glucose fuel is dependent on insulin. So anything that is connected with insulin resistance, like all the problems like metabolic syndrome, high blood pressure, high cholesterol, belly fat, liver fat, inflammation, dementia, all these body problems, and there's quite a few. And you pretty much bypass any of these problems that are associated with insulin resistance. They tend to go bye bye when you start changing over the fuel system. Now, deep inside your cells, you have the mitochondria. That's the energy factory of the body. And deep inside the mitochondria, you have something called the Krebs cycle. And it's really complex, but it's basically converting glucose into energy. But when you run your body on ketones and fatty acids, you don't need to involve all those different steps that are involved with glucose. You only need to use one or maybe two of these many different biochemical steps that glucose needs. This saves you a lot of energy. So it's like running your body off of a much better machine and it produces a lot more energy. When you run your body on ketones and fatty acids, you actually take a huge stress off the mitochondria. And if you don't already know this, the majority of non infectious diseases that we experience involve the mitochondria. And I'm including cancer at the top of the list. When you run your body off too much glucose, it destroys the mitochondria with all sorts of reactive oxygen molecules. I'm not going to get into the weeds with that, but the point is that there's a lot of side effects when you run your body off too much glucose. You get enhanced mitochondria function. You have more oxygen involved with the mitochondria. You need less fuel to run the body. You even need less thyroid hormones to keep your metabolism up because the thyroid gland runs more efficiently. And your liver doesn't have to work so hard. You have to realize that the liver has to do a lot of different things. It's like 500 different functions. And when you run your body off of fat and you decrease the need for glucose in the brain because the brain can also run on ketones, well, most of it can, only a small portion needs actual glucose, that your liver can now just focus on that really important action of producing new glucose for the brain and certain other tissues like red blood cells, and that's called gluconeogenesis. You basically give your brain a chance to chill out. You give your heart a chance to work better because the heart is a muscle, just